Life can be a beautiful tapestry, woven with threads of experiences, memories, and relationships. Yet sometimes these threads can become frayed and tangled, leading to confusion and distress. Alzheimer's disease is one such condition that can cause these tangles, affecting not just the individual, but also their loved ones and caregivers. Alzheimer's disease is a progressive disorder that causes brain cells to waste away or degenerate. It's the most common cause of dementia, a continuous decline in thinking, behavioral and social skills that disrupts a person's ability to function independently. Imagine the brain as a city with everything interconnected. Alzheimer's disease is like a storm, causing damage and disrupting connections, leading to symptoms like memory loss, confusion, and difficulty with thinking and reasoning. Firstly, let's demystify what Alzheimer's is not. It's not a normal part of aging, although the greatest known risk factor is increasing age, and the majority of people with Alzheimer's are 65 and older. However, Alzheimer's is not just a disease of old age. Up to 5% of people with the disease have early-onset Alzheimer's, which often appears when someone is in their 40s or 50s. Secondly, Alzheimer's has stages. These stages can help us understand the progression of the disease. The early stage is often overlooked because the onset is gradual. Individuals in the early stage of Alzheimer's may be able to live independently, but they are likely to start experiencing memory lapses. The middle stage is typically the longest and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. In the late stage of Alzheimer's, individuals lose the ability to respond to their environment, to carry on a conversation, and eventually to control movement. Thirdly, it's important to understand that every case of Alzheimer's disease is unique. Just as each person is unique, so too is their journey with Alzheimer's. Some people may live 4 to 8 years after a diagnosis, but others may live as long as 20 years. Symptoms can vary widely, and the pace at which the disease progresses can differ greatly from person to person. Now let's wrap up the key points discussed. Alzheimer's disease is a progressive brain disorder that impacts memory, thinking skills, and the ability to carry out simple tasks. It's not a normal part of aging, but age does increase its risk. The disease has stages, and each person's journey with Alzheimer's is unique. In the end, remember that understanding Alzheimer's is the first step to dealing with it. Armed with knowledge, caregivers and families can provide the best possible care and support for their loved ones. And though Alzheimer's may fray the threads of memory and cognition, it does not erase the value and worth of the person living with the disease. Each moment of connection, each shared laugh or tear, is a testament to the resilience of the human spirit, even in the face of adversity.